In the meantime, the Lagos State government has again re-echoed the need for residents to consistently and aggressively practice social distancing, as it is an essential means of containing the spread of the coronavirus. Speaking at the daily briefing on COVID-19, Commissioner for Health, Professor Akin Abayomi, while confirming the 11 new cases who tested positive for the virus, also projects the virus to hit 39,000 in Lagos, except residents of the state practice aggressive social distancing as a responsibility.
Is a very suitable place to erect a temporary structure because the stadium in itself provides adequate physical facilities. It's been recently renovated, everything is brand new. It has lots of ablution facilities. Doctors and nurses can be, the architecture can accommodate doctors and nurses, overnight stay, and it has conferencing facilities, it has catering, it has ablution facilities. So it's a perfect place to put a temporary structure on the playing field. So why are we doing this? Well, we feel it's better to be prepared than to be sorry. So we are making an exaggerated attempt to increase our capacity to isolate positive cases. If we don't need it, all well and good. But if we need it, then it's better that we have made the provision for it. Our mathematical modeling shows that the worst case scenario is that we may see up to 39,000 cases in Lagos State. However, if we practice good social distancing, we might be able to limit that to about 13,000. If we add social distancing to active contact tracing, then we'll be able to bend the curve even further to make sure that we turn the graph around, we flatten it, and we start to see a subside.
In another development, Professor Abayomi says 16 Nigerian students are currently at the Seme border, where they have been stopped from entering Nigeria. He also said many Nigerians are trying to come into the country via the land borders since the closure of the airways.
The details of who will be discharged, I do not have the exact details here because I haven't been to the center yet, but later in the afternoon, the team on ground will present to me and to Mr. Governor the patients that have recovered and are ready for discharge. And we're expecting that over the next couple of days, we're going to be discharging many of the early patients that we've admitted as they've completed their treatment protocol and they have now recovered and are ready to go home. So as we discharge patients, we will now be admitting new patients. So it's like patients in and patients out.